I will say, like I said, the titration, the nitroglycerin drip question is really the only one that's different. And so we'll go through that as a scenario. And I'll probably just start with that one, and then we can always go back and do any of the other questions that you might have. I never really know what you as Boyce students kind of have questions on. But just know that you can ask whatever, and I'll let you know if I know or don't know. So this review was, and if you've taken reviews with me before, you've probably know that I said that, oh, okay, you did the nitro question last semester too. Okay. That was the only thing that I was like wondering if that was different, but apparently it's not. So okay, well, that's good. I don't know if any of you knew Maddie, but she put together this this review that I've stolen and swiped and reused and repurposed for the Boyce campus, because before that there was, apparently you guys don't get any kind of review packet like we give the students at Allegheny campus. So I don't know. Hopefully that's changing, and I can provide some of this material and disseminate it to you. So if you happen to make something new or add new questions, please send them my way. I'm happy to share that with other students if that makes it easier for you to do. So if you've already done the nitroglycerin question, then there's really not much difference between what you saw last semester to what you're seeing this semester, other than you might have a few more heparin, bolus heparin infusion questions. So you maybe last semester it was 2, now it's 4. You might have a few more flow rate questions where they're going to ask you to calculate milliliters per hour or calculate 2 drops per minute. You'll have some insulin dosages. That's mainly just looking at the sliding scale, but you might also have, or you will also have, some insulin infusion questions, which honestly are no different than the heparin infusion questions. But notice that there's nothing in here that says anything about pediatrics, so you don't have to worry about calculating a safe dose range, answering the question whether or not you will administer that particular medication. I'm assuming you guys do that in the 230 class, just like we do at Allegheny campus. So since you've already done the nitroglycerin question, first of all, if you want me to go through that example, I'm happy to do so. But if you have another question or another type of scenario that you'd prefer to see, just let me know. Okay, rounding drips. Okay, yes. So first of all, can you so someone was asking like about on my review it said something about a partial drip rate. Can you tell me which question that's referring to? I just want to make sure. Okay, thank you. So let me just double check, because there shouldn't be any partial drips. Okay, and then yes, I will do the nitro or a nitro question too. Okay, so let me make sure it's the same 24-25 that you have. I must have a different 24-25. Oh, okay. Are you an Allegheny student, or are you a Boyce student? Oh, okay. All right. You were just looking at that for additional practice. Okay. So let me pull that up so I can make sure I get that corrected. Do you happen to recall which 240 review it was? Okay. Let me just see, because it might just be like something is wrong. So I'm gonna pull this up. We'll just see if it's the same thing that you have. Well, let me just see what I have here as the key. And I will say the first one that I have listed is like from 2016. So if that's, I don't know if that's the same thing you have listed there. Okay, so it was 2016. Okay. So then let's now, and then you can correct me, and then the copy that you're looking at, it should be printable. All you have to now, the only thing I don't know about is if my writing will be there. So I will tell you that there is um a PDF version in the 230 folder. That's pretty much the same thing that I'm going through, and then you should be able to print that off if you're unable to print off what I've put now in a new folder. I created a 240 folder for Boyce so that we keep these all together. Okay. So to answer your question, let me just double check and make sure we're talking about the same thing. So the 24-25 that I'm seeing are these two right here, these flow rate questions. Is this what you're referring to? These here? Okay. Because that's the first test, the 16 fall 240. But if you tell me the title of the test, I'll make sure I get the right thing for you. Sorry, thanks for everyone being patient here. Okay. Yeah, that's fine. Yeah, I don't know which one it is because yeah, you're fine. You're not stopping. I just want to make sure I have it confirmed because there is no you can't give someone a partial drop, but you can give someone a thank. That's fine. Yeah, you can just email it to me. The if I gave somebody like 8.7 milliliters per hour, like that, from what I understand, is perfectly fine because you can give a fraction of a milliliter. You can give a decimal of a milliliter. You may not be able to program that into an actual infusion pump, but as far as the math is concerned, you could do that. With drops, you either have the option of giving a whole drop or 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 none. You can't give a half, you can't give a quarter. It's you give the drop or you don't give the drop. And so that's how that works. So, all right. But let me go ahead and go back to and let's look at the titration question. So what I'm going to do is I'm just going to clear out my work since it's been a little while since I've worked through this. And that way you can see what we're doing here. So all we're doing with the nitroglycerin question is it's just a bunch of conversions. So we're going to be converting things like milligrams and micrograms and minutes and hours. And there's a couple of different things that we're going to do. And then we're even going to introduce doing the converting the converting minutes to hours, like just to kind of get an appropriate flow rate. Now we'll add because I know at Boyce it's notorious that you will not be given the units that you're looking for. You're just supposed to know, and at this point I think you already know that. But typically when they ask for flow rate typically means milliliters per hour. So if they just tell you calculate the flow rate for whatever, it's milliliters per hour. What gets a little bit confusing is sometimes they'll say calculate the drip rate and they're talking about the same thing, meaning it's still milliliters per hour. So like heparin drip rate is still going to be milliliters per hour. It's just that it's very, very it's a low number. So it might like be 10 milliliters an hour, which is just kind of at a very slow pace, just dripping out, which is why it's called the drip rate. But if you're calculating a drop rate, you need a drop factor, which is either the micro tubing or it'll tell you it's the tubing is 5 drops per milliliter or 10 drops per milliliter or 15 drops per milliliter. So you need a drop factor in order to calculate a drop rate, and then your drop rate is drops per minute. So there are two common flow rates that you need to know, and have an idea of how to get to your answers with that. But in this nitroglycerin drip question, what we're going to see is that we're going to put a patient on nitroglycerin drip. The example says 50 micrograms per minute, and your nitroglycerin is mixed at 25 milligrams in 250 milliliter bottle, which gives us a concentration of 100 micrograms per milliliter. So it tells us what the concentration is. Okay. So, and I just want to double check that that's not incorrect. Yeah, okay, that is correct. So one of the things that's helpful for this is everything's in the same unit. The only thing we need to do is convert minutes to hours after we do everything else. Now, sometimes this question might get asked and say, okay, well, what if it was 50 micrograms per kilogram per minute, and then you had milligrams per milliliter available, and it didn't give you the micrograms per milliliter? Meaning, like, what if it didn't tell you the 100 micrograms per milliliter? You could still answer the question. You might just have to do some converting, which I'm confident you guys can do. But for this question, you're just going to take your 50 micrograms per minute. And then you can do this now, or you can do it later. You can convert minutes to hours now, or you can do it later. I'm going to wait and do it later. I'm going to convert micrograms to milliliters. So 100 micrograms per milliliter. And then I'm going to convert minutes to hours. This is probably the step that's most commonly missed, is students forget to convert minutes to hours, and then you get some small number, a decimal answer, and you need to make sure you multiply by 60. So I'm going to see if the answer is 30. So 50 times 60 divided by 100, and I believe you're right, 30. Yes. So what if your order was 60 micrograms per minute? What do you get as an answer when you do that? Good. Yep. That's what I got too. So if you got 36, I got 36. Okay. And then all you're doing is 60 times 60 divided by 100, and then you'll get 36 milliliters per hour. Now I have well, let me just see what else I have here, because there's a couple different scenarios of this question. So here's another scenario. So it tells us that we have, I have a feeling that this question was supposed to go with the question below. So let me just back up here. Okay, so we might need to change this answer. So this is giving us a different scenario. So this actually says 50 milligrams, 250 ml, which is a different concentration. Okay, so let's try doing this question here. So if it's 60 micrograms per minute, and then it's 50 milligrams per 250 ml, what do you get with that? So it won't be 36. So 36 was following this. This is a different scenario. So let's see if we can get to the same answer together. And I'll get us started. You guys are plugging right along. Now, the only thing I'm doing here that's a little bit different is I'm making my conversion here. So let me see if I also get 18 just to make sure we're all on the same page. So 60 times 60 times 250 divided by 50,000. And I also get the same thing. So it sounds like everyone's kind of on the same page, which is good. Testament to that you know this stuff. Okay. So yeah, 18 milliliters per hour. So that's what these nitro ones are. There might be one. I just want to see if there's another. This is a range one. I don't think you would see a question like this. This is very similar to what you would have, or what you kind of did in 230 in the pediatric dosages, where you calculate like a range. And so that's what they're showing you is the range. And so the way I did this, and most likely the way you did this as well, is you just took your 15 micrograms and then your 200 micrograms and just compared it to your available, and then you came up with your range. So this might be like a way to like step up an infusion. And maybe they would say like, hey, we're going to go, like it says here, we're going to infuse the IV solution at a rate of 4.5 milliliters per hour to 60 milliliters per hour, or 4.5 to 60 milliliters per hour over a period of time. But it's the same thing. They're just like I said, Maddie did a really good job of pulling and finding these questions to give you a different variety of things that you potentially could see on your test, even to the point where I think some of these are a little bit more challenging that you would see on your test. And so if you can answer them, you should be really, really good to go. I have another one that I use. I'm going to pull up from my from Allegheny campus. And I'm going to add this to the review because I think it's another good nitroglycerin type question that I think you might appreciate. So let me pull that up. Just because it also incorporates like a weight-based question. So I'm just going to add it below this one here. All right. So for this one, instead of it being nitroglycerin, it's dopamine, but it's going to follow the same rules. And then in this scenario, there's actually a weight component to it. So what it's asking you to do is still calculate. Now, this looks to me more like a Boyce type question because it says, at what rate should the nurse begin the infusion? Which sounds a little bit more like what I envision that you got, the type of questions that you guys get asked, where it doesn't tell you like calculate milliliters per hour or anything like that, but you know from doing this now for three semesters that's what you're looking for. Okay. And if it wanted a drops per minute, there would be something about a microtubing or some sort of a reference to drops, and that's just not here. So when you do this, you're going to set this up the exact same way, except you're going to do one step before you do your, converting the time, and you're going to take the patient's weight, 70 kilograms, times the 5 mic per kilogram per minute. And then you're going to get 350 micrograms per minute. and then everything else you're going to do exactly as we've been doing. So the only thing that's here that's different is the whole is the adding the weight-based component to it. So 250 ml, 400,000 micrograms. And then I'm sorry that my writing's getting a little bit slanted here. It helps you stay awake trying to figure out which way I'm going to go next in my writing. And then you just plug that into your calculator. So 350 times 60 times 250 divided by 400,000. And you get 13.125. So you would just round that to 13.1 milliliter per hour. Okay. Are there any that you'd like to see that you have some just need a refresher on, like reconstitution, the conversions, your parenteral or your oral based meds? Just let me know. All right. Let's get you some heparin. Okay. So if you've looked at the Allegheny campus heparin protocols, they're a little bit different. I'm not in 100% certain because I haven't seen. Yes, this is the 230 practice test because this is all I have. I don't have anything specific for 240 for Boyce, but I do know that the questions are pretty much the same style. But if you have other examples or you have other things or previously you've missed certain questions and you have more feedback, please let me know and I'll make sure that I get those corrected for you. So the way that your heparin protocol and your heparin questions are written are a little bit different than how I've written them. And I'll show you an alternative scenario. But we'll just go off of what is already here that we can use that. Actually, you know what? I'm gonna give you one of my examples. That way, you can have something a little bit new. So give me 1 second. Yeah, let's work through. Hold on 1 second. I gotta pull up a different test. I've been doing this since 10:30 this morning, so I'm just kind of like finding everything and trying to get myself back on task and making sure I don't chew up too much of your time. There we go. Okay, here we go. Perfect. So what I'm going to do is I'm going to give you two scenarios here. Now, from what I understand, if your questions are asked similar to the way our questions are asked, you will where are you? You will have similar questions that are being asked as they are here. And so meaning that you'll have you'll have a question that in basically you have to answer two questions. You have to calculate a bolus and you have to calculate an infusion. So it should be the same as what you did previously, but I'm going to give you a different scenario here and see what we get. All right. So let me create some spacing here. All right. Okay, thank you. So so someone just told me about doing inches to centimeters, so we can do that. And then creamy tomato. So creamy tomato, if it's creamy, then that usually that's going to tell you it's milk and water. So you would just count, it should count. I mean, I could be wrong about this, but it should count as the full thing. If it was chunky tomato soup, then there's less liquid than what is said in there. But if it's creamy tomato soup, it's predominantly just a liquid. So meaning that you can calculate a milliliters from that. So if you got that, I'm assuming that if you missed that one with the creamy tomato soup, that maybe you counted it as a solid, and it should be a liquid, unless they're telling you it's a solid and it not a liquid, but it should be a liquid because I've made tomato soup. I've made it from scratch and it's liquid. That's so you can calculate the volume of that. The reason you don't calculate the volume of like a fruit cocktail or chunky soup is because the solids make up more of the soup or the cocktail than does the liquid part, so it doesn't count as your liquid as far as intake is concerned. And then inches to centimeters, I'm actually surprised you have that, but we can certainly do an example of that. All right. So for insulin, the example I gave is we have a patient that's 132 pounds, and then you're just going to follow the weight-based heparin protocol. You're going to calculate for a bolus, and then you're going to calculate for an infusion rate using the order and the available dosage. So step one is we want to convert the patient's weight in pounds to kilograms. So 132 divided by 2.2, and I'm going to get 60 kilograms. Now, sometimes if you're lucky, they'll give you kilograms, okay? So I'm going to take that patient's weight in kilograms, 60, and I'm going to multiply by my order, which says 80 units per kilogram. 60 times 80 is 4,800 units. And the next thing is we're looking for milliliters of bolus. So technically, if you have a unit syringe, you could give them 4,800 units, but they specifically asked for you to calculate for milliliters of the bolus. My guess is that that's what it would be in general. And so in order to calculate the bolus, we have to convert using the bolus dose. So the bolus dose strength is 1,000 units per milliliter, which is why I'm going to use 1,000 units per milliliter. And then you're going to get 4.8 milliliters. So your bolus dose is pretty much consistent. Really, the only thing that changes if you're using like a heparin protocol, usually the only thing that changes is the patient's weight, or there's differences in the APTT. But we'll cross that in just a minute. And then if I'm calculating an infusion rate, again, I'm using the same patient weight, that 60 kilograms. It tells me to set an infusion at 18 units per kilogram per hour. I'm just going to write this a little bit differently. So kilograms gets eliminated. 60 times 18 is 1,080. And then we're going to convert units per hour to milliliters per hour. So this is very similar to what you're doing with your heparin and your insulin infusions, where you're just converting units per hour to milliliters per hour. We're going to use what we have available in the IV, which is the 25,000 units and 250 ml. So I'm going to get rid of units and I'm going to convert it to milliliters, 250 milliliters, 25,000 units. And then I'm going to get an answer of 10.8 milliliters per hour. Make sure that looks like a 10, not a 6. There we go. Okay. So that's how you do the bolus dose and the heparin infusion. Typically on this question, it's 2 parts, meaning that you'll get calculate the bolus and calculate the infusion. At Allegheny campus, it's 2 questions, but it counts as 1, meaning that if you miss one or both, you've only missed 1 question. If you miss, if you get them both right, which you should with practice, then you get the whole credit for the question, but it's just 1 question. You may also see where they kind of revisit the, that's supposed to be APTT. There's too many T's there. We revisit the patient's clotting time, and we look to see what happens with that, and then if we need to make some adjustments. And then it tells us to rebolus with 40 and then to increase the rate by 2. And so in order to do that, we're just going to take our same patient, same weight. So they still weigh 60 kilograms. Now in this, instead of 80 units for the bolus, we're only going to do 40. That's going to give me 2,400 units. Again, we don't want units, we want milliliters. And if you're ever stuck and wondering, well, which available do I use? Because I have 2 availables that have units and milliliters. If you're calculating bolus, use the bolus. If you're calculating the infusion, use the IV. Now, I've been doing this for way too long, so I have these all memorized. But this is 1,000 units per milliliter, which gives me 2.4 milliliters, which probably makes sense, right? Because if my original was 4.8 and I just cut it in half, 2.4 milliliters makes sense. Now, the second thing says to increase the rate by 2, but it's units per kilogram per hour. So you don't want to do 10.8 plus 2 and get 12.8. That's not how you do this. You're going to increase the original, which was 18. So again, I'm going to take the patient's weight. 18 plus 2 is 20. And this is kilograms per hour. So I get 1,200 units per hour. And then I'm going to convert units per hour to milliliters per hour. I'm going to use my available, the 25,000 units and 250 ml. 25,000 units, 250 ml. and I'm going to get 12 milliliters per hour. So notice if you had added the 2, you would have had 12.8, which technically is an incorrect answer. So that's why you want to make sure that you add your 2 units to the 18 units per kilogram per hour when you do that increase, if it's even asked to you. My guess is it won't be asked to you, but I just gave you an example question, and Maddie gave you similar example questions that you can practice heparin with. Okay. And we can come back to that if you need to, but I'm going to go ahead and I'm going to add in one of these inches to centimeters question. It's been a long time since I've done any kind of that kind of conversion, but I just want to see if I even had that conversion there. Do you guys use 2.5 or 2.54? Or is it 3.5? 2.5. Okay. Let me just see here. I'm just looking to see where I want to put that in here as a practice question. She kind of skipped those. Okay, let me put this up here. So let's just add it to our household and conversion questions, because it does say we have 2 questions here. So I'm just going to add it in here. I'm just going to. So let's say I have, so I'm going from inches to centimeters. So let's just say they're asking me to convert 5 inches equals how many centimeters? Oh, okay. Converting a newborn's measurement of inches to centimeters. Okay, then let's do that a little bit more specifically. So that's probably a decent estimate of a long baby. Does anyone with kids remember the length of their baby? I'm pretty sure one of my daughters was 22.5 inches. So that's in centimeters for the baby. So if we're going to do that conversion, we know that, 1 inch is equal to 2.5 centimeters. Is that correct? I want to make sure that I'm doing it right. Okay. So then we're just going to do a conversion here. So I have 22.5 inches, and I'm going to convert inches, centimeters. 1 inch is 2.5 centimeters. And so it's going to do that calculation. 2.5 times 2.5, which give me 56.25 centimeters. Now, if I'm doing this the way that I would traditionally do this, I would tell you, so 56.25 centimeters, and then I would tell you to round that number to 56.3 centimeters. However, your instructors may tell you not to do that depending on the context of the question. But the reason I would say to do it is because you're going from the American Standard Unit inches to the metric system centimeters. And so they're not going to add up exactly the same way. Kind of like when you go from pounds to kilograms, you round to the nearest tenth. I'm assuming you would do the same thing for this. But without seeing the question and knowing what that is, this is my best guess as to what they're asking you to do is to convert inches to centimeters like this. So do you remember if you missed it based off of rounding or just didn't know or couldn't remember what to do with the 2.5 number? No, I'm asking you to reach.
So, Dr. Rad, From what I remember, it was just asking a question, just a simple how many centimeters were in an inch. That,
Okay.
that's what I remember it from.
Okay. Yeah, I'm sorry that you missed it. I don't know what to say as far as you know, what else to do. That, like I said, I don't typically see that type of question, but okay. Oh, okay. You're saying okay, you got it right, but it just wasn't what you expected to see. Okay, fair enough. That's why like you caught me off guard because I'm thinking I've not seen that. But I guess it's fair game. And so you could see it, especially since you've already had pediatrics. So they could ask, an inches to centimeters question. I just I'd be surprised because it seems like they would want to spend more time challenging you on like heparin protocol and doing the nitro drip conversions and things like that. So I don't have a good answer for you, but thank you for your question. All right, I have about 15 more minutes. Any other questions? Yeah, as far as rounding is concerned, you just gotta follow your typical rounding rules. So like, yes, so when you do metric to metric, so if I'm going from grams to milligrams or milligrams to micrograms, you do not round those basic metric to metric conversions. Okay. So if you get an answer that's like 1.052 grams, then that's your answer. You don't round that to 1.1 or anything like that. You leave it as it is when when you're just doing just a straight up converting metric to metric. But if you go from household to metric or metric to household, then you might need to round. And if you're going household to household to household, I know that's household to household is what I meant to say. Um, you probably won't need to round because they're within the same units. So, like, if I tell you 2 cups, and then to convert that to ounces, it should be an even number, so you shouldn't have to worry about that at all. Um, but whenever you go from different units of measure, you probably are going to end up needing to round. So like if you go from pounds to kilograms, or if you go from cups to milliliters or ounces to milliliters, you might need to round. Usually that's not the case because like um ounces to milliliters is a whole number, 30, but like pounds to kilograms is 2.2. So yeah, drops, whenever you do drops per minute or any drop, it's always rounded to the nearest whole number. So if you get like 34.6, as your answer, then your answer is 35 drops per minute. And then as far as flow rate, as far as I understand, you still can round to the nearest tenth if you are calculating for flow rate in milliliters per hour. So like you could get an 8.7 milliliters per hour or a 125.5 milliliters per hour. The only thing I can say is that you probably won't see that as an answer. They usually factor that into your final answer. But if you want to be 100% certain on that, just ask your instructor and then ask for clarification on the flow rate rounding rules. But it should still follow the rest of the rounding rules where you round to the nearest tenth. Yep, you're welcome. I want you to know, like, if you're wondering, like, where, like, so if I get a direct message, that's what I'm responding to. So you may not, you can't see what I see as far as from a direct message standpoint, but I'm just letting you know. Um, what I'm responding to. So that's a good question. So you have to clarify that a little bit for me. So someone asked if I know if the questions would be factual or fictional. Do you mean like kind of like some of these scenarios here, like it probably is not an actual like what you would actually be prescribed. Like the heparin protocol is pretty true to form because it's standardized. If you do a Google search for heparin protocol, you'll see what those numbers listed there. So the only thing that really changes there is the patient's weight. So all that seems pretty factual to me. But fictional might be something like the way I would denote that unless you give me some more context, like let's say you get an answer of 34 drops per minute, but in reality, you can either set your tubing or your infusion to 30 drops or 40 drops per minute. So if that's what you're talking about, then it would be following more of a, what you actually get from a math standpoint and not actually what you would be doing in a clinical setting. Yeah. And I think I answered your question, but I don't think that's silly at all. I think I always say, you're in what we call the math bubble. So, or the CCAC dosage calc math bubble, and you just kind of follow the rules as far as math rules within that bubble, because you might do something completely different in reality. Like, let's talk about like just administering Tylenol, right? So let's say you're supposed to give somebody like 245 milligrams, based off their body weight, and then you only have available like 325, and so you just give them one, so you're giving them more than they need based off of maybe a weight-based calculation, but it's like the standard. So unless they're a kid, then you wouldn't give them that quantity. But that's all I'm saying is like there might be some discrepancy as far as that's concerned in reality. There's a reason why a lot of your like I used to work in a pharmacy, and in the pharmacy we would always say like um in a pharmacy setting we would always say it was always like 500 milligrams, and then you had 250 milligram tablets available. It always seemed to work out pretty easily, and that's probably because it's standardized. So anyways. All right, about 10 more minutes left. Any other questions, comments, concerns? Yeah. So there's a bunch of questions on here for the heparin bolus. Now, are you saying anything beyond what is already here? Like, have you gone through these other ones? What I'll do is, yeah, let me give you another example. And I'm just going to focus on these first two questions. So we're not, so like I said, the only thing that really changes with this is the patient's weight. So that's all I'm going to do is I'm just going to change the patient's weight. And then I'll give it to you as another example. So I'm just going to add it to here to give you some additional scenarios. All right, so let's say the patient weighs, instead of 132 pounds, let's say it's let's just say it's 262. So this gives you like a larger person. And then I'll let you go ahead and try this one out. and then I can stick around until you get to that answer. Or if you want to email me, that's fine too. But go ahead and see if you can solve for your bolus dose and your heparin drip, given the order and the available here. And if you get an answer, just type it into the chat and I'll confirm it. If you want to just send it as a DM so you don't give away the answer, or if you just want to go ahead and answer it, and then I'll confirm or deny or see if you got the same thing I got. And I'll just put the answers here just so you have it as a reference. And hopefully get the same answer. But I got 9.5 milliliters for the bolus and 21.4 milliliters per hour for the infusion rate. Now, in reality, could you set it to 21.4? I don't know the answer to that. It might have to be set to 20 or 22 or 25 or whatever that happens to be. But given what I know about, at least from the blueprint and your rounding rules, this makes sense to me. So all right. Well, I think that's a good place to stop for this evening. If you have any other questions, please feel free to email me. I will put my email in the chat just in case you don't already have it, but you can always get it from Professor Priori. I know I'm saying her name wrong. At ccac.edu. So you can always message me if you have questions or types of questions that you'd like to get covered. And then I will also be doing a 240 review for Boyce on Thursday morning at 9:30 before I start up with my other ones. And so, like I said, if you between now and then, if you have any other questions, let me know. And then you can always email me, and I will also upload the review that I do Thursday morning to the YouTube channel as well. And then you'll have access to that. So if I don't see you before your test, I wish you good luck. Hope you do well. And if you need anything, just reach out and let me know.
Thank you.
You're welcome.
Thank you.
Absolutely. You're welcome.